So the COVID-19 pandemic has once again put workers' and employers' rights into the spotlight. The CCMA has been inundated with cases about mandatory vaccines and COVID-19 testing. New guidelines by the government have reiterated employers' rights to implement vaccine mandates and clarify reasons that employees can refuse this. Let's unpack all of this for you now. Joining us in studio is Mandisa Mashego. She's with AFRO Womanist Movement of South Africa. Dr. Pamhidzai Bamu is with the African Labour Law Society, and Professor Ames Dhai from the South African Medical Research. Two of our guests via Zoom. Mandisa, as I mentioned, with us in studio. To all of our guests, hello. Thanks very much indeed for your time. It's lovely to have you on the program. Shall I begin perhaps in the room with, broadly speaking, a stance around this contentious issue? Things that need to be balanced typically when this conversation comes up is, where do we draw the line between personal liberties and autonomy and what is considered to be public health and broader safety, so to speak? Where are you on that spectrum?
Good morning, Ayanda. Look, there's a lot going on with the COVID situation and the globalized attack on our individual human rights as natural beings of this planet. Let's start in the beginning. There's still a debate amongst scientists because you must remember that the current regime of vaccines, so-called vaccines, was not subjected to peer review until global scientists fought about it, something which doesn't happen in science. You can't fight about peer reviewing an invention or an innovation or an advancement to an existing innovation. Secondly, let's discuss the other geopolitics around the virus itself. You would know that it's been consistently referred to as a novel virus, which means it's brand new. Like there's no virus like it that has ever existed before. That is a big problem because in the context of how it was handled, removed from scientists, from virologists, from immunologists, from chemists, from all sorts of medical experts and practitioners, in terms of the discourse of this outbreak, right, of the COVID virus. That was removed from the medical and scientific profession and rested purely in the hands of politicians, starting with the United Nations, namely the World Health Organization, and presidents, various majority presidents
of the world. What do you mean by
world.
that? What do you mean
what basically happened was that you would know now there's an ongoing attack on workers and scientists all over the world, right, in the healthcare sector, who, when they come up with a different view based on their own peer review of this entire COVID situation, they either get threatened with their jobs, they get threatened with removal of their degrees. It happened to a specialist, I think she was a cardiovascular specialist, a female doctor who was working for Netcare in South Africa. It happened with, is it Professor Mdladla, if I get the surname wrong, please pardon me, who is an anesthetic specialist at the, one of the training hospitals in Tshwane, medical training hospitals, who was threatened with his jobs when he came with different views about the origins of the virus and all the other politics around the virus. So the reason I'm taking it back there is because I want to be very clear that when it comes to the COVID vaccine, I'm an anti-vaxxer and I'm very proud of it, because there's a lot wrong with this situation. The third factor that I wanted to factor in is that this situation of the emergency use authorization is something that was brought in by the FDA, which is an American drug administrator, right? Similar to our SAPRA, not similar, SAPRA is subordinate to FDA, not by the World Health Organization. That is extremely wrong, which means we've all then been subjected to American policy and regulation in relation to the health sector. I want to come to why I'm saying what I'm going to say.
Before you do that, because we do have other guests that I imagine would like to respond to at least the ground that you've laid for our discussion. No. So let me pause that thought and bring you, Dr. Bamu, into this discussion. I mean, you know, I wonder if there's anything in particular that Mandisa Mashego has had to say that you reckon is in line with the chronology of events as it's unfolded. She's spoken about, you know, the vaccines, the current candidates we have, not necessarily being open to peer review until demands were made for that to happen. The fact that, you know, COVID-19 is a completely new virus, a novel virus, and that brings forward its own complexities. Is the version of events as put by Mandisa completely accurate?
I think that there definitely is some truth in that. And one thing that has been problematic and frustrating, I guess, relates to openness and transparency, which is very important if one is to establish a clear scientific basis for saying there's a vaccine mandate or there isn't a vaccine mandate. Is that necessary or is that not? Before we even get into debates around the rights, to be able to establish the necessity of having these vaccine mandates, there must be openness and transparency around what the implications are, and there have been instances where this has been problematic. And one, there are many people that have, given good evidence of the fact that there are sort of hidden agendas around why that has happened and so on, which I wouldn't want to really get into without, to be more neutral. Mm-hmm. But there definitely are some problematic aspects around how this virus and, the response has been handled.
Professor Dhai, is that a sentiment that you share? The fact that there are just still so many unanswered questions, and we need to actually deal with those first before we enter this conversation around making vaccines mandatory?
Unfortunately, I was unable to hear the second speaker. So I can't comment on what she says, but I will comment on what our first speaker said,
sure,
where she alleged that, everything was removed from the hands of scientists. And I would like to see the evidence for that, because I can assure you that leading scientists globally were very, very involved in this work towards developing a vaccine, and it had to be developed post-haste if we were going to have survival of our global communities. And in terms of it being just US-centric, I don't agree with that either. And I do not agree that SAHPRA is a subordinate of the FDA. SAHPRA is an independent organization within our statutory requirements, and it is managed in terms of the Medicines Controls Act. So it is not a subordinate of the FDA. What we saw around the vaccine development was global solidarity and global collaboration towards developing vaccines so everyone could be safe. And just to remind our speakers what the World Health Organization kept on echoing, and that was no one is safe until everyone is safe. Every time they promoted the vaccine discussions. In terms of the healthcare workers that were supposed to have been removed from their positions, we also governed by the Health Professions Act. And the Health Professions Act actually makes it mandatory for us to do what is in the best interests of our patients, which includes responsible messaging as well. And where healthcare professionals have not adhered to this principle of best interests, that's when issues have arisen. And they have been reported by society and other healthcare professionals to the Health Professions Council to be, taken up for disciplinary action in that regard. I do also want to stress that if we need to look at safety of the world and survival of our communities, we need to look at it from an ethical perspective. And if we use ethics as a cardinal principle throughout, I don't think we would be actually at that debate as to whether vaccines need to be made mandatory or not.
Okay, let me say up front that I've been very generous with the opening remarks from all three of our guests. It's not going to be that way as we continue with our discussion, so gird your loins. Ethics is an interesting addition to bring into the discussion, because we do know that ethics aren't sometimes clear. And so the question becomes, how should we be reading about where we are as a globe, given the data we've been able to collect about how vaccines actually work? We'll continue with this discussion when we come back. With us, of course, we're continuing now our discussion around the issues to be ventilated on this Workers' Day when it comes to making vaccines mandatory in the workplace. And for that end, or to that end, we're joined by various guests. Professor Ames Dhai is with the South African Medical Research Council. Mandisa Mashego is with the AFRO Womanist Movement of South Africa. Dr. Pamhidzai Bamu is with the African Labour Law Society. And to all three of our guests, once again, thanks very much indeed for your time. So those were really just the opening remarks. Mandisa, if I can bring the discussion back to you. But I wonder if we can move forward, right? We have the benefit of hindsight where we're at when it comes to trying to ascertain whether these things work or not. The data, even in this country, is showing that most of the people who are getting sick, who land up in hospital because of COVID-19, happen to not be vaccinated. I don't think you think that's just a coincidence.
I don't trust what the South African government issues.
This is coming from scientists. This is coming from people who have no interests, some people might argue.
Be that as it may, let's look at the issue of people experiencing adverse side effects to this thing and the information that all citizens are required to know before they vaccinate about, whatever risks concerning the vaccine, and then post them being injected, what they should do. Majority of our citizens in the township areas, in the peri-urban areas, in the rural areas of South Africa, in the slum dwellings, are not, they do not have access to online facilities to register adverse effects. They don't even know what that is. I spoke to many people who went back to vaccination sites to report adverse effects and side effects, and they would literally be turned back quite brutally by nursing staff. It's not uncommon, and we all know in South Africa that majority, overwhelmingly, of the public health system is in tatters and offers terrible, putrid, service to their patients. So the issue here is not about what the statistics say that come from the Department of Health or any other state agency, because we all know we've had 2 years, and please pardon us for being paranoid, but there's a lot going on behind the politics of this thing called COVID. We all know very well that there's been a pattern of cheap public relations slanting. Whenever they wanted to start some sort of campaign to then introduce a new variant, a new strain, you would suddenly get an upsurgence of testing, and then you'd be bombarded by the media yourselves with statistics suddenly. And then in between, there would be no statistics about what's happening. It's almost as if there's basically no COVID movement and there's no viral infections. And so please pardon us for being a little bit paranoid, but I want to come to this.
Before you do that, what you've just said is important. Are you insinuating that the waves and the variants are being orchestrated?
Well, I'm not sure what they're doing. I can't factually say what they're doing, but there's definitely a PR stunting exercise and campaigning happening. I'm basing it precisely on what I was saying, Ayanda, that in between the campaigns, the testing campaigns, there's no activity happening. We all know, we've seen testing sites that basically are empty. We all know that people were induced with money. It's publicly open. You can Google it. There's certain retail groups that have been offering people in the townships money and vouchers, shopping retail vouchers, for them to get injected with the so-called vaccine. That's a fact. I'm not making that up.
But that was an incentive to increase the vaccination.
Why would you give an incentive to give somebody something which is on trial? Because let's start off with the fact that the entire duration until very recently, when I know the UK government and I think the FDA as well in America, of course we're all now governed by the FDA. I'm not sure what happened to national sovereignty anymore. But nonetheless, when the UK government then finally, I think it was a couple of weeks ago, announced that 2 or 3 of the vaccines have now been approved post-trials, prior to that, majority people, especially poor people, especially people who have an education deficiency and do not have access to very sophisticated ways of getting information, were not aware that they are participating in a medical trial. There's been no information on SAPRA's side to alert citizens about the risks of participating in a medical trial. When you participate in a scientific medical trial as a human being, not as a rat, there are certain things that you must be aware of, which means possibility of death, that's the fact that you cannot sue, the fact that your life insurance potentially may not pay. Most life insurances and insurance companies do have clauses about participating in medical trials. There was no information about that whatsoever. And
let me interrupt you, and apologies. I did warn that, because there's so much to go through, there'll be moments where I do interrupt you. And there's a lot that Mandisa has said, Professor Dhai. You with the South African Medical Research Council, a big part of what you need to do is to, I guess, track the numbers, the data. You are often among the people who tell us when there is a wave on the way. What Mandisa Mashego is saying is she doesn't know whether she can trust that because of the politics around these vaccines. What's your response to that and around this perception that, the current vaccine candidates were all part of a massive trial, even to the point where they were rolled out to the public?
So I think Mandisa brings up three issues, and the first is vaccine hesitancy and lack of confidence. And we can tackle that. The second issue is systems failures and lack of access, not only to vaccines, but to information and to reporting. And these are real issues on the ground. And the third issue is, do vaccines actually work? So, and a fourth issue in that when people were involved in clinical trials, they were not actually, they went in without having adequate information. So I'm going to start off with the last one, the CCMA trial, where it was the healthcare workers that were the first to be involved in a stage 3B trial of the vaccine for emergency use. And this was done as a phase 3B trial to look at whether, the feasibility of implementation. The vaccines had undergone all the checks and balances from phase 1 to phase 2 to phase 3A. And we as healthcare workers in the country went into phase 3B trials. We understood what we were involved in the main, and there was a clamor to receive that vaccine. Now, I wonder if Mandisa can actually explain why the healthcare workers actually went in their droves to get these vaccines, especially if we were uninformed. I think I do agree with her in that when you look at society in general, people on the ground mostly do not have access to, to infrastructure that would allow for them to have access to information. And this is where I think our system has failed the people on the ground. They failed the people on the ground, and we have poor uptake of vaccines, not because vaccines don't work, but because the anti-vaccination sounds seem to be louder than the sounds that we actually need from our state, our government on the ground.
Let me bring in Dr. Bamu there in the interest of time. You've also touched on various things that I think are quite important. Dr. Bamu, again, we do have the benefit of hindsight because we're dealing with actual real-life data now that we can refer to. Part of that data comes in the form of the cases that have come before the CCMA, which has in some instances ruled in favor of the employer who has dismissed someone who's an employee for refusing to take a vaccine. That's just putting it broadly. Do those cases, do you think, give us any more clarity around how to deal with what is really still quite a complex issue?
I think there's a lot that's problematic if one considers the fact that we don't have adequate information. I think one of the things that Prof touched on in response to what Mandisa said relates to information, access to information around what it actually means to be taking the vaccine. And I don't agree that it's an issue of just lack of infrastructure for people to be informed, because the very same channels that are used to spread the message, come and get vaccinated, and should be the channels that are used to make sure that there's balance in the information that a person is receiving. So I think we've seen a lot of cases around side effects, deaths, etc. And a lot of that has been downplayed in the vaccination message. I'm not an anti-vaxxer, but I certainly believe that one should give informed consent to whatever they're getting into, because that is otherwise a violation of various rights, including the right to bodily integrity. So coming to the CCMA cases, I think there's one, the Mulderidge case, where the employee, basically in the end, the ruling said that the employer was justified to dismiss the employee on the basis of permanent incapacity because they did not want to take the vaccine. And that, for example, is almost like a twisting of the legal principle of how incapacity works. Incapacity really relates to what is inherent in doing the job. Saying I'm going to take a vaccine or not going to take a vaccine is not necessarily something that determines whether you are able to do the work. So it almost feels like a stretching of the principle around, what would justify a dismissal in order to make it possible to do that. And that in itself is problematic because there are various issues and considerations to take into account in making those kinds of determinations. So, yeah, I think maybe I'll leave it there for now.
Yeah, and it's an interesting element to add into the discussion. Mandisa, let me bring you back into the chat as we hit the home stretch of what we can ventilate with the time we have.
Yeah.
Let me ask this. What information would you want to be privy to in order to consider taking a vaccine tomorrow?
Okay, I need to respond to, is it Professor Dhai first?
In a minute, because I'm looking at the time as well.
Yeah.
Sure, go ahead.
Health workers agreed to be vaccinated because their jobs were threatened. When you threaten people with an income, with their livelihood in a poor country, they'll literally do anything.
Is that fair to say, though? Was it all of them?
Of course.
All of them didn't want to take the vaccine?
There's ongoing threats against workers in all sorts of companies, across industries, in government. There's ongoing manipulation. There's ongoing, it might not be happening maybe in your sector, so I would forgive you for not seeing that. But if you're on the ground and you're talking to people and people are talking to you, like me, you would know this kind of thing. I have people crying on a daily basis.
All the healthcare workers who took the Johnson & Johnson vaccine didn't want to take it?
I'm not saying they didn't want to. I'm responding to her saying that why did they agree to take it? I'm saying they agreed because their jobs were threatened, like it is happening now. The law protects employees and protects citizens and protects workers. We've got all sorts of workers' rights, right, in the Labor Relations Act, in the Basic Conditions of Employment Act. But you would know that the current attempts to basically violate our constitutional and human rights by the Department of Health to amend the National Health Act are basically amendments that seek to be very, very far-reaching and literally overreach the Act itself and overreach as an overreach to our rights.
Okay.
Because basically what they are saying is that you're not going to have a right to decide whether you want to vaccinate, not to do necessarily with COVID, any other form of medication that they choose to introduce.
Okay, that's
the
one
other big
issue.
problem with the vaccines is that these are profit-driven medical interventions. You cannot deny the reality of that. It's actually a sin and it's unconstitutional and it's against our human rights for any government to take our tax money and participate in anti-competitive behavior, which basically says that you have to vaccinate otherwise. We know this is happening in China right now, where people are being forcefully injected in their houses, literally almost at gunpoint. You cannot take our money and choose to give it to a profit-making entity who you have no idea what they're doing with those profits, even in terms of medical research. There's a lot of sinister things that are happening today, even in terms of, interfering with rain, even in terms of interfering with weather.
Okay.
There's a whole lot of sinister stuff in the capitalist imperialistic world, in collusion with governments. You cannot deny
Point
the
taken,
reality of
Mandisa.
that.
We're running out of time. Anything else that you wanted to respond to? Because what I was trying to get at is the view you have of vaccines.
Yeah.
What information would you need for you to consider the effectiveness of vaccines in 20 seconds?
I would basically need threatening intimidation not to be part of it.
Right.
I would need economic apartheid and medical apartheid as an attempt to subjugate the world to control and authority by profiteers and basically billionaires not to be a part of that equation. And I would need my full human rights and my constitutional rights as a South African citizen, as an African citizen, especially as a woman who bears children, to be guaranteed before I can be told what medicine to take and what medicine not to take. I have a right to die should I choose to.
Sure. I think many people would actually agree with that final statement. Professor Bamu, your closing remarks? Professor Bamu.
We need to be very... Oh, sorry.
Professor Dhai?
So, healthcare workers in the Sisonke trial were not forced to take the vaccine. The primary principle in research ethics is voluntariness. And we went in voluntarily because we needed to ensure that both lives and livelihoods were being protected. And we worked in terms of the public health principles for the greater good for all. I think it's important to take into consideration the tension between individual rights and collective good. While it is understandable, this ought to give way to public health needs, which in the case of our pandemic include to secure protection against death and severe disease. Those that are in ICUs and are dying are mostly the unvaccinated. To also reduce onward transmission of the virus, to reduce the risk of ongoing mutations into variants of concern, and to relieve the pressures on the ICUs and to protect healthcare workers and allow them to attend to the needs of patients with non-COVID-19 medical conditions.
All right.
In addition, once we go into waves again, we're going to get restrictions, and this is going to result in continuing contraction of economy, loss of jobs, etc. And I think this is going to be very bad for the health of the nation. I think when we look at individual, we need to look at the health of the nation as well.
Point taken. Dr. Bamu, so much being said. I wonder, given all of that, whether you reckon we're anywhere near being ready to start introducing mandatory vaccines, if that is a consideration.
Yeah, I think it's probably... We're in a very difficult position because as it stands right now, we have guidelines, we have a code of good practice that it allows for mandatory vaccines after, making assessments and so on. The employer can make assessments and make a determination as to whether people should be vaccinated. But the one thing that is problematic is the fact that there isn't room for social dialogue or for consultation amongst the different stakeholders before such a plan is established. So there are policies that affect livelihoods, employments, jobs, where workers do not even have a say. The scientific basis for actually making this determination, looking at risk, looking at exposure and so on is problematic. And the other thing that we have to consider is what is reasonably necessary, what is proportionate when one is trying to balance the rights of the workers versus the public interest and the public goods. Is it actually necessary to go this route, or are there other less restrictive means that can be implemented in the workplace to ensure that the transmission and so on are curbed or minimized as much as possible, reducing the risks of spreading the virus, right, whether there is justification for that or not. So there are various things that one could consider, but we still have a long way to go. And I think it's a new virus. We've been trying this vaccine out, and we still need to get to, a more factual basis for which to make these determinations. And I'm not quite sure that we are there yet.
I should have started our discussion by saying there is no way we're going to be able to get through everything with the time we have together. But thank you very much indeed. All your points came across loud and clear. Dr. Pamhidzai Bamu is with the African Law Society. Also joining that discussion is Professor Ames Dhai from the South African Medical Research Council. With us in studio, Mandisa Mashego, who's with the AFRO Womanist movement of South Africa. The kind of conversation that does need you to take a bit of a drink. We're going to do that quickly.